Welcome back to our Power of Data stories. Every number has a story, every report answers a question, and every insight gives us an opportunity to serve women more effectively. I'm Kelle Berry, Next Level Manager for Heartbeat International. In the last episode, we talked about using data to improve marketing. We asked, who are we reaching? And are we reaching the women our mission exists to serve? But getting the right women through our doors is only the beginning. Once she gets there, we have another important question to ask. Are the services we're providing actually meeting her needs? Because data isn't only about telling us what happened. Data can reveal what people need. And sometimes what our clients need today isn't exactly what they needed 5 years ago, or even what we assume they need right now. We're going to look at some data to see the stories they tell. But first, we'll start with the story. Imagine a restaurant that's been in the same neighborhood for 20 years. It has loyal customers. It has a menu people know. Every morning, they look forward to a huge breakfast at 6 a.m. The owner is proud of that breakfast. They've always served breakfast. They've invested in it. They've trained their staff to make it well. Their customers know exactly what to expect. But one day, the owner starts to notice something is different. The dining room is mostly empty now at 7 a.m. But around lunchtime, people are lining up outside. This is different. Why is it different? The neighborhood has changed. The people have changed. There are more young professionals working remotely, more parents with small children, more people looking for a place to meet during the day. The people need adjustments as their lifestyle and resources have adjusted. Now, imagine the owner looking at that information and saying, but we've always been a breakfast restaurant. We've always served breakfast at 6 a.m. There's nothing necessarily wrong with the breakfast. We can actually still offer breakfast, but now maybe it's breakfast for lunch. The question is whether the restaurant is responding to the people it's actually serving today, or is it going to continue serving the people from before? Our ministries can do something similar. We develop services because we see a need. We build programs, we train staff, we create schedules, and many of those services may be excellent. But over time, it's easy for our service to continue simply because that's what we've always done. Data gives us an opportunity to stop occasionally and ask, does what we're offering today match the needs of the women who are actually coming through our doors today? That's our leadership question for this episode. What are the needs of the women we are aiming to reach and serve? In episode 2, we said data doesn't replace wisdom, it informs wisdom. That same principle applies to client services. A report cannot sit in a leadership meeting and tell you, add an evening appointment, change this class, stop offering this program. That's not what data does. Instead, data gives us evidence and helps us ask better questions. We're looking for the pattern, and it shows us, hopefully, the pattern. Then we combine that pattern with what our nurses, our advocates, our volunteers, and other client-facing team members are seeing every day. This is also where reports can become much more than something to review at the end of the month. For example, our next level reports can be used as a regular part of evaluating your services. You start with the center dashboard to see the larger picture. Then when something catches your attention, you dig deeper into the client, the medical, or the other reports that can help answer your next question. Remember what we said in that last episode, reports don't make a difference. The decisions they inspire do. So today we're going to use 2 pieces of sample data to ask, who are we serving? What appears to be happening as we serve them? And then what might we need to investigate or change? If you're listening rather than watching, you'll find the sample charts with the episode resources. We will start with age demographics. Here we have a graph that if you saw this in the last episode, you saw this. We have a graph that's telling us about our different ages and who we're reaching. Last month, we looked at this through a marketing lens. We asked, who are we reaching? And does our marketing align with the women our mission exists to serve? Today, we're going to look at that exact same information through a completely different lens. This is one of my favorite things about data. The same number can help us answer more than one leadership question. In this sample data, 70% of clients are between the ages of 18 and 34. And the largest group, 42%, is between 25 and 34. Last month, we asked, what does this mean for our marketing? But today, I want you to ask, what could that mean for our services? Now, don't rush to an answer. Start with questions. And if most of our clients are between the ages of 18 and 34, what does that tell us about their schedules? Are they working? Are they in school? Do they have other children? What might transportation look like? Think about that in the same way as the restaurant where you saw the people change when they arrived for the same exact service. What does that look like for the people in your community? When can they realistically come to the center? How do they prefer to communicate? What kind of education or support is most useful to them? What barriers might be preventing them from returning? And here's another question, flip it over. Were our current services designed around the clients we're serving today or around the clients we were serving several years ago? The chart doesn't actually answer those questions. It tells us which questions may be worth asking. That's an important distinction. Next, you may open a different report that answers the next question and going on, so forth. So don't let the report make that decision. This is where we need to be careful with data. Suppose we look at this chart and say, most of our clients are young adults, so obviously we need evening hours. Well, maybe. That chart doesn't prove that. Instead, it has given us something to investigate. And that's where an interactive report becomes useful. Instead of stopping at this first chart, in next level, our reports will let you continue exploring. So for example, you might filter on a particular date range, or a location, or you might go into appointment activity and see what that looks like. You'll review which services are being provided. If a visual raises one question, click into it or use the available drill through to look behind the number. Then talk to your client services team, the people who actually talk to the client, and see if they can give any insight. Look at the appointment patterns, look at the no-shows, and when appropriate, ask the client. Review which services are being used. Maybe you'll discover that evening hours would remove an important barrier, or maybe you'll discover something completely different, perhaps virtual appointments. Data should create curiosity before it creates conclusion. That's how we keep reports from becoming cold or clinical. They're stories about your client. Those bars represent real women. Our job isn't simply to analyze them. Our job is to understand how can we serve them better. So demographics can help us understand something about who is coming through our doors, but ultimately we need to know more than whether people are using our services. We need to now ask whether our services are helping us accomplish our mission. Remember our conversation from episode 1. Appointments are important. Pregnancy tests are important. Ultrasounds are important. Classes and material assistance are important. All of these activities are important. But reporting what we did is just the beginning. Eventually, mission-focused leaders need to ask what is changing. And that brings us to our second chart. Next, we'll talk about client intentions and measurable movement. This sample report looks at the latest recorded intentions of clients who were identified as at risk for abortion. We'll start with 2025. There were 291 at-risk clients served. Of those clients, 210 had a latest recorded intention to carry to term. That's about 72%. The sample goal is 70%. So we're above it. Now, look at 2026 data. Year to date, there are 48 at-risk clients represented. 32 intend to carry to term. 16 remain at risk of choosing abortion. That's about a 67% reporting changed intentions toward choosing life, compared with a 70% goal. So 67% compared to 70%. Now, it would be very easy to look at these two percentages and say, we're doing worse. But if you've been listening, you probably know what I'm going to say next. Slow down. A number gives us a place to begin. It doesn't always give us the answer. It actually gives us a question. So next we need to ask, what does this number mean? First, 2026 is year to date. So we're comparing a partial year with a completed year. It's always important to make sure you understand what your data is actually showing you. And so we're actually working with a much smaller number of clients here. So instead of immediately labeling 67% as good or bad, let's ask what is happening. We have women coming to us that are moving toward carrying to term from the at risk of abortion. So we know something, we're reporting some movement, but others are still considering abortion at the latest point we have recorded. Now we have something worth understanding. This is a great example of where you don't have to stop with just the summary number. Your reports can help you move from that high level, like I mentioned before, into the details behind it. You may be able to hear filter the report, select a category, or drill through to look more deeply at the clients going into that. And so at Next Level, we value that. And we have a report called Client's Journey so that you can see what how your center is touching that client as she goes through that journey. And maybe you can look here and see what is impacting that decision. So you can start asking, what was different for the women whose intentions changed? What services did they receive? Did they receive an ultrasound? Did the barrier that they had that was making them feel like abortion was their only option, did you address it? Did they receive practical support? And did someone stay connected? What was the follow-up like? Then we need to ask the other side of that question. What about the women whose intentions didn't change? What were they facing? Were there needs we couldn't meet? Were there barriers we didn't identify? Were there services they needed that we don't currently provide? Or is there something else entirely in the data? Those are the service questions. And now our report has moved us beyond how many women did we serve to how effectively are we serving the women who need us most? How are we impacting our community? That's important. But there's another important distinction here. If a woman's intentions change after receiving services from your center, the report shows us that movement, but it's not actually proving why her intention changed. Maybe the ultrasound was important. The conversation with the advocate definitely mattered. The material support removed a barrier, but also maybe her family circumstances changed. Many of those things have an impact from what we've done. Maybe several of those things work together. But that's why our data and your client-facing team need to be together in this conversation. Your report can show you something is happening here, but now your staff can help you understand that. And that's why we're looking at this number together. We're seeing what's behind the number. Together, those two perspectives can help leadership understand what to investigate next. So now let's pull our two reports together. The first told us who are we serving, and in this sample, most clients are between 18 and 34. The second told us something about what is happening with a specific group of those clients. Now we can start asking richer questions. For example, are there differences in intention movement by age? Do younger clients identify different barriers than clients in their 30s? Are there particular services associated with clients who move toward caring to term? And are any of these needs in housing, childcare, employment, transportation, relationships, going on and on? You know all those possibilities. Our two charts don't actually answer those questions, but they tell us where to look. They tell us what to ask. And our different reports give you those different places to go. You can start with that high level and then go downward into their activities and engagement or into their medical services you provided, and then looking at the different things in between those with different dates and different details. Remember what we said last month. No single report tells the whole story. Think of each report as a chapter, and then together they help us understand our ministry. And sometimes one chapter gives us a question that sends us to another report or to the people closest to the work for the next part of the story. So next, we need to turn this insight into action. How do we actually use this information to improve services? We can use the same basic process we've been building throughout the series. First, notice the pattern. What does the data show? Maybe our client demographics have shifted. Maybe intention outcomes have changed. Maybe utilization of a service is increasing or decreasing. Use your center dashboard as a good starting place to do this regular review, and it gives you a high-level view of your center's activities, trends, and impact. Don't explain the pattern yet. Just first, notice. Second, investigate. Use reports to dig deeper. Filter the data, interact with the visuals, drill into records behind your numbers when you need more context. And bring the information to your team. They're a valuable resource. Ask them, what are you seeing? Talk to the nurses, advocates, volunteers, and when appropriate, listen to your clients. The people closest to the work may add context that isn't visible in a report. And then third, choose one thing to test. Maybe it's your service hours. Maybe it's the follow-up. Maybe it's a referral or an education that you provide. You'll discover that a service, you may discover that a service you already offer just needs a slightly different change. Perhaps it needs to come earlier in the client journey. The change doesn't have to be enormous. In fact, starting smaller often makes it easier to understand whether the change actually helped or not. And then finally, 4, measure again. This part matters because if you just make the change but then never come back to the report, you never know what the impact of that change was. Use the same filters and measures, look at the trend over time. And if we change something but never return to the data, we don't know if it actually worked. So make sure you do this fourth measure again. The report doesn't create the improvement. What you learn from it, what you decide to do next, is where the impact begins. So let's imagine that our center notices that most of our clients are between 18 to 34. Our staff also tells us they're hearing repeatedly that clients have difficulty returning to follow-up appointments because of work schedules and childcare. So we have two pieces of information. The report is showing us who we're serving, but now our team has given us more information behind that number. So now we've noticed something. So before making a major change, we might use our reports to investigate further. What does our appointment activity look like? Are there patterns and missed appointments? Which services are clients returning for most often? Or are there differences by location? Now we're using our reports not just to report activity, but to help evaluate how we're delivering our services. Perhaps we just need to test one change, and ideally it's just one change. For example, maybe 3 months we offer different scheduling options, or maybe we adjust our follow-up process. Then finally, don't forget to go back, measure the impact, look at your reports. Did the follow-up improve? Did you hear from more clients? Did more clients return? Did the outcomes change? What did your staff observe? What did clients tell us? We're not changing our program because someone had a good idea in a meeting. We're learning, we're testing, we're measuring. That's a different way to lead. So here's your leadership challenge before our next episode. Choose one service your center currently provides, just one. Then open your reports and ask 3 questions. Who is using this service? What need are we trying to meet? And what evidence do we have that it's helping? Don't stop at the first number. If something catches your attention, filter, dig deeper, look at another report, drill through where it helps. Then bring one question to your client-facing team. What are you seeing that might help us understand this data? From there, identify one small change or one thing you want to investigate further and decide when you're going to review the data again. Because the goal isn't change for the sake of change. The goal is learning what helps us serve women more effectively. Your services aren't the mission. They're tools your center uses to accomplish the mission. And good leaders periodically ask whether those tools still match the needs of the people you're trying to serve. Your data can help you do that. Reports can show you who's actually walking through your doors, and they can reveal patterns you might otherwise miss. This can help you move from a high-level number to the details behind it. They can show where meaningful movement is occurring, and they can point you toward places that deserve a closer look. But the report isn't the destination in itself. Reports don't make a difference. The decisions they inspire do. And good decisions begin with curiosity. Data should create curiosity before it creates conclusion. So use your reports to ask better questions, use your team to add context, and make thoughtful changes. Then come back to the data to learn whether those changes help. That's how data becomes more than reporting. It becomes a tool for continuing improving how we serve. And that's the power of data stories. Remember, every number has a story, and every story matters. Next month, we're going to take what we've learned about client outcomes and look toward our teams. We'll explore how data can help identify opportunities to train, encourage, and equip your staff and volunteers, not by using numbers for judgment, but by using them to learn together and strengthen the way we serve. I hope you've enjoyed our time together today. Thank you for joining me.